Hello, and welcome to another Rush Generations Health Education Lecture. Rush Generations and our staff is delighted to be your source of information, resources, health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, September 24, and I'm Grisel Rodriguez Morales, Rush Generations Program Director. I'll be your moderator for today's lecture, Falls Prevention. And before I present to you the wonderful speakers joining us today, I like to start by thanking our producer, Hannah Weitzman. And Hannah will also help us manage the chat and other key aspects so that we can all have a great conversation today about reducing fall risk, improving balance, and how to stay safe. As always, we are live streaming this lecture via our Rush Generations YouTube channel. Remember to subscribe and like the video, especially today, because avoiding falls could make the difference between you living independently or needing constant assistance. So let's see. As always, we're also using the video platform Zoom because it allows us to host a good number of people who join us via phone. Thank you for being here as well, for joining us. And for those of you that are on YouTube, we ask that you please use the chat function to ask questions and or to add to the discussion throughout the lecture. And we will make sure that your comments and questions make it to the presenters. And for those of you listening to the discussion via phone, you will also have an opportunity at the end of the presentations to unmute your audio so that you can as well ask your questions. We like to remind everyone that all the information offered here is for general informational purposes only, and to always seek additional professional advice for situations specific to you and your needs. So without further ado, I would like to introduce our speakers. And today we are going to start with Dr. Bindiya Patel, who completed her master's degree in biology before pursuing a residency in family medicine. She's currently a geriatric medicine fellow at Rush University Medical Center, where she's passionate about advancing care for older adults and promoting healthy aging. She lives here in Chicago with her husband, who is also a physician, and together they enjoy exploring the city, discovering new coffee shops, and spending time with family and friends. Yes, connections. That's great. Thank you for for being here. And then we will also have our colleague, dear colleague, Padre Stanley, who is the program coordinator of community integration for Rush Generations. And he's also with our Department of Social Work and Community Health. In this role, he oversees the quality and integration of Rush Generations evidence-based groups interventions into community sites. He also recently finished the National Falls Prevention Research Fellowship with the National Council on Aging. So we cannot wait to hear from him as well. So without further ado, I think we're gonna start with Dr. Patel, right, Hannah? Let's see. Yes, let me, go ahead. And turn on your video if you like.
Hello, can you guys
Yes,
hear me?
yes, we
Yes,
can hear you
hi.
perfectly.
Okay, great. I'm Dr. Patel. I'm a geriatric fellow. Thank you so much for that introduction. Um, we're just going to be talking a little bit about fall prevention. This is Fall Prevention Awareness Month, and so a very fitting conversation to have with anyone. So we're going to move forward. I have a little bit of a presentation, and then, like we discussed, we can answer any questions at the end. Um, so we'll begin. I do work at Rush and currently a fellow at Rush. So um, I do have a lot of my geriatric medicine background from there. We'll talk about falls. Next slide, please. And we're going to talk about the background of falls. Um, so let's start with the next slide. How do we define a fall? It does seem like kind of um, a question that seems a little intuitive, but I do think that it is important to describe what a fall is. It is described as an event whereby an individual unexpectedly comes to rest on the ground or another lower level without knowing a known loss of consciousness. So this include falls that exclude seizure, strokes, or syncope, which is syncope is described as dizziness, where you lost consciousness in that specific moment. We'll discuss a little bit of statistics. Um, these were reported through uh, medical journals, CDC. So I'll report some of these with to you guys, how important falls are, especially in the older population. Greater than 1 in 4 adults that are aged 65 and older experiences fall each year. That's approximately 36 million falls annually in the US. Once you fall, there is a doubling chance that you will fall again. So it's super important to prevent them. Um, 1 in 5 falls do cause serious injuries, such as fractures, head traumas, and are the most common reason of a traumatic brain injury in the elderly. More than 3 million older adults are treated in the emergency department each year for fall-related injuries, and over 1 million hospitalizations annually are due to falls, most commonly resultant of a hip fracture or a head injury. So, with these statistics mentioned, it is very important to discuss falls. We'll discuss ways to um, how to move forward in regards to talking about it with your primary doctor or how to do exercises to help prevent falls. Next slide, please. So, what are common causes of falls? Causes of high risk falls, like I mentioned in the statistics aspect, a history of a fall does have a higher risk of having another fall. So that is the number one cause. Uh, Taking multiple medications, specifically psychotropes or sedating medications, which we'll discuss examples of in a couple of slides. Visual impairment, including cataracts, glaucoma. So it's very important to make sure that you're going to the eye doctor every 6 months to make sure that your vision is appropriately managed. If there's any difficulty walking, weakness, unsteady gait, those are all indications that might be a high risk fall. Decreased muscle strength. If there's any drug use, cannabis use, alcohol use, um, blood pressure changes with postural changes, reduced muscle strength, and lastly, feet problem. This includes neuropathy, weakness, atrophy, or lessening of the muscle in the legs can all cause high risk falls. Next slide, please. So, medication related falls, identifying and managing the risks. So, this is what I was discussing a little bit earlier in regards to having multiple medications. As we age, our bodies process medications a little bit slower. And so, increasing the likelihood of a side effect of a medication. That being said, when we take 5 or more medications, that does raise the risk of falls. And 3 out of 4 adults have at least one medication on their list linked to falls or can even cause car crashes. That being said, not to put fear or make someone concerned about the medications they're taking, but it is important to discuss with your primary doctor to see which medications you need to take and which medications you're able to eliminate if it's not needed for a chronic condition or a condition in general. Um, Another thing that is kind of discussed but not really harped on is risks that are um, associated with over-the-counter medications or supplements. So these can include Benadryl, Tylenol PM, um, other sleeping aids such as melatonin that you can get over the counter. These all do have some effects of causing a little bit more drowsiness that have been shown to result in falls. And so something to keep an eye out for. Other examples of prescription medications that you may be getting from your physician to keep an eye out on are blood pressure medications. So that can, have a risk of dizziness, cause your blood pressure to be too low. If you have dehydration, you have a higher risk of a fall. Any sleeping aids or sedatives, such as benzodiazepines or zolpidem, anticonvulsants, which are for seizures, pain medications, such as opiates or muscle relaxants, and then, like I mentioned earlier, alcohol and cannabis use are also associated with higher risks of falls. So these are all just things to keep an eye on and discussing it with your primary doctor to have a plan in place. The best takeaway, I think, from my whole presentation will be to have a relationship with your primary care or your doctor that you do your visits with regularly to keep a relationship to be able to discuss these if you've ever had a fall or you had a fall recently, if your medications are causing any side effects, it's important to notify your physician. Um, so we did, sorry, next slide. We did discuss that a statistic early on in this presentation that approximately 25% or over of older adults fall every year, but only 1 in 10 of those individuals discuss it with their physician. So it's like I mentioned in the previous slide, it is super important to discuss and um, discuss any falls or near falls that you might have had with your doctor. It's never hesitate to discuss this with your doctor because they are able to make improvements in regards to your medications or even just recommending exercises or preventions to prevent them. Any supplements you're taking, I would recommend also discussing it. There are some side effects that aren't as readily known with supplementation. So it's really important to discuss this. Another thing to note is when you are at your primary doctor's office, if there is concerns of gait or how you're walking, and that might be causing near falls or falls, to have that assessed. Another thing that's super important is an osteoporosis screening. We call it a DEXA scan, and a DEXA scan is a prevention or a preventative screening tool for osteoporosis. So that can help with preventing hip fractures, femoral fractures. These are just important things to do to prevent. And then if you have changed or started any medication, talk to your doctor about it and have a close follow-up to see how you're doing on that medication. Next slide. Screening of falls. So there's a couple of things. Um, some may be intuitive, some may be a little bit more informative. So you want to inform your primary care provider about any recent falls or concerns if you do have, or your family is concerned about falling. If you have assisted devices, this includes rolling walkers, canes, that those are properly fitted and in good condition. Your primary doctor is able to order a new one or able to adjust the one that you have, find the resources at least to help you properly get fitted. So that's super important to discuss if that is a concern. And another thing that I always tell my patients is to make sure that every year they schedule an annual wellness visit, because this is the time where you have an allotted time with your primary care provider to discuss all the preventative measures, including falls. And that includes a fall risk screening. So if your primary care provider is concerned that you've had a fall or you are at a near miss of a fall, they will do a couple of things to assess. That one of them includes a timed up and go test. And so this test, not too long of a test to perform in office, but it assesses your mobility and balance. And so that would be able to assess your risk of falling. They also, like I mentioned before, should be analyzing your gait and evaluating your walking patterns and evaluating and identifying any risks that may be present. And then lastly, a foot exam, especially if there's a history of diabetes or any neuropathic pain, it's important to make sure that you have appropriate footwear as well as checking for any ulcerations or any pain in your feet. And then we have the next slide, prevention of falls. So what are four things, sorry, next slide. Yes. Four things you can do to be safer. I know sometimes providers, including myself, may be, you know, offloading all this information, but what can you as the patient do to make yourself feel safer? As I mentioned, talk to your doctors about your medications, including supplements. That's the biggest take home, I could say. Getting your feet and eyes, especially checked your eyes should be checked every 6 months. Increasing your strength through an exercise regimen. And if that is unavailable, also you can ask for if you're able to get physical therapy. That is also a great way of increasing your strength. And then lastly, making sure your house is safe. That is something that is overlooked, and we'll discuss it a little bit more in the next couple of slides on how you can make adjustments at home to make sure that your house is safe to prevent falls. Next slide. So, how can you make your house feel safer? So I'm going to go through a couple of things that may be helpful in regards to making adjustments to your house so that you're able to be most efficient and optimize decreasing fall risks. So first off, we'll talk about floors. So using a non-skid rug. Some of these rugs have a very they are slip resistant, so that's a good sign, but some of them aren't, and so it's important to make sure that that is in place. If there are any extensions, cords, wires, those are appropriately taped or coiled away so that there's no hazards of tripping. Um, Keeping any pathways clear from excessive furniture or hoarding in general. Having a lot of stuff in the house can also cause a risk of a fall. And that brings me to my second point, keeping the floors clear of things that can trip, such as shoes, other little trinkets, decor. You just want to make sure, not that I'm saying that don't have your house decorated, that is not by any means what I'm saying, but making sure it is at a place where it does not get in the way of your path. The next thing we'll talk about is a bedroom. So ensuring that lamps are easy to reach, and lights are appropriately um, fixed so that there's adequate lighting in the rooms. Um, Plugging in a night lamp also makes a huge difference. Installing phones on the floors, on each floor, if you live in a multi-floor house, to make sure that those are easily accessible if there is an emergency. Um, in the kitchen, you can often keep things that are frequently used in easy to reach places. So if there's a specific pot or a pan that you're using more frequently, rather than something that you use only on special occasion, you should keep the things that you use more frequently at an easy place to reach, just so that it decreases the risk. And then never use a chair or step stool. Always ask someone for assistance. Um, and then stairs. In regards to stairs, fixing loose or uneven steps is a huge one, as well as installing handrails on both sides with adequate lighting so that there isn't any chance of missing a step. And lastly, attaching non-slip rubber treads to each step so that when you're taking a step, it's easy to grip. And then the last thing I'm going to talk about is the bathroom. Installing bars next to the toilets, in the bathtub, in the shower. Very important. Installing a non-slip mat and even considering a shower chair if that is something that's needed. So these are all ways that we can just make our house, not all of them are needed. And, if that's something that you find that you would like to accomplish all of these things, that would be wonderful. But it's just optimizing your home in a way to prevent something that is preventable. So I got this a checklist from Ohio Health, but there are multiple checklists online if that's something that's if someone's interested in. I don't mind leaving the website on the chat, because it is a really good way of um, managing your house in a pretty easy way. Next slide. I also left a um, I if people aren't more if they don't like to visualize, there is a more of a checklist based um hall home fall prevention checklist that I also attached, that's through the CDC. And so they have really good tips and tricks on this checklist as well for home prevention, and it's allows you to have some way of having an organized way of fixing hazards in your home. Things that are a little bit different in this checklist are keeping objects off of the stairs, which is always an important. Everyone should be practicing this, just because having objects on the stairs will cause higher rates of falls, or falling from the stairs. And then they also mentioned fixing loose or uneven steps, making sure that there is a switch on top of the stairs and the bottom of the stairs. I do got to say, this checklist is more um, detailed in regards to stairs and steps, just because as healthcare providers, we do see more falls related to stairs and steps. And so it does a really good job at making sure we can do things to optimize stairs, steps, and preventing falls through that. So making sure that there's a light switch at the bottom and the top of the stairs is something that's always um, a good way to prevent a fall, and making sure that both the top and the bottom switches are um, the same light so that you don't have to run up and down the stairs to hit the lights. If the stairways has a light bulb, making sure that it's appropriately fixed and providing the light that's needed. Um, it also mentions to make sure that there is a non-slip rubber tread to the stairs and making sure that the handrails of the stairs are appropriately um, uh, a part of the stairs so you're able to use them and they're not loose. Um, Other things that they have mentioned that's a little different is making sure that there's no papers or books on the floor. That is a little bit more specific to this checklist, just because that's a higher slip risk. And making sure that if you have a wires or lamps, telephone extension cords, those are appropriately also put away. Otherwise, a lot of the other things are very similar to the previous checklist. Like I mentioned, this is just a different visual representation of a checklist. So through the CDC, um, again, I can provide these links if anyone is interested. Next slide. So, what can we do other than doing these little modifications to the homes to help prevent falls. We can also get stronger. Um, you may be hearing Tai Chi by your medical providers. It has been proven that Tai Chi has builds patients' muscle and makes them stronger, and that can prevent falls as well as physical therapy, just staying active, being on an exercise regimen, where it will go over an exercise at the end of this presentation. But just having an exercise regimen, and that doesn't mean that you have to do something super strenuous. That can also entail something like going for a walk 3 or 4 times a week. We particularly like our patients to go. I always tell my patients 5 times a week, at least 30 times, 30 minutes a day. Um, the USPSTF requirements do recommend 3 to 5 times per week for up to 30 minutes a day to get a total of 150 minutes. So as long as there's some sort of movement, I would highly recommend that. That even includes if you're sitting in your chair and just lifting your legs up and down, moving your arms up and down. You, your body needs to keep being used. Otherwise, there is a degradation of muscle. And so that's always important to keep track of. And the last thing is don't be afraid to use mobility aids. That includes canes, rolling walkers. Um, those are assistants to keep you mobile. And so I think of it as something that's actually helping you get stronger rather than something that's hindering you. So something to keep an eye on. And then the the next slide goes over the chair rise exercise. This is a recommended exercise through the CDC that we found. Something like I mentioned that you can do from your chair, and it just increases and strengthens your muscles in your thighs and your buttocks. So the goal to do this exercise is to do it without using your hands. So there's a representation on the slides, but I can explain it to you as well. So how you do it is you sit towards the front of a sturdy chair. The key word being a sturdy chair, with your knees bent and your feet flat on the floor, shoulder width apart. Then you rest your hands lightly on the seat on either side of you, keeping your back and your neck straight and your chest slightly forward. You breathe in slowly, lean forward, and feel your weight on the front of your feet. You breathe out and slowly stand up using your hands as little as possible, but they're there if you need assistance. Pause for a full breath in and out. Breathe in as you slowly sit down. Do not let yourself collapse down into the chair. Rather, control your lowering as much as possible. And once you're seated, you breathe out. I recommend my patients to do this at least 10 to 15 times. You can start slowly though. That number is just a recommendation. Even if you're able to do 5 or 6 and then you work your way up to 10, it's something. Um, so it's always important to make sure that you're staying mobile. And so this is one of many exercises. And if you're in physical therapy, they are they do have home exercises that they do provide. And so that is something to keep note and making sure that you are optimizing your physical therapy by getting home exercises. Is something I always recommend my patients to do. So that's most of my slide. I'm Dr. Patel. I am a geriatric fellow. I work at the Senior Care Center here at Rush. So if there's any further questions, I do believe I will be on until the end of the presentation and we can answer any questions or concerns that you guys have. I appreciate your time.
Yes, thank you. And we're going to have then Patrick join us. Hi, Patrick, and welcome back after your presentation.
All right. Thank you so much, Dr. Patel. That was really great. And it feeds really well into our next presentation. So today I'm focusing drilling down on how fall risk and mobility are connected to social drivers of health. So my name is Patrick Stanley, and I'm the program manager of community integration with the Rush Generations team. So a lot of you may recognize me as well. But I was very privileged. I just recently wrapped up my a research fellowship. So I was a National Falls Prevention Research Fellow with the National Council on Aging, funded by the U.S. Administration on Community Living. Um, and so I was one of the inaugural fellows and was just really honored to be part of that program. So and very happy to share with you a little bit of my expertise and some of my research that was done through that fellowship. So Dr. Patel talked a lot about falls risk, and I think that she really did a great job about talking about the multifactorial nature of falls. And so multifactorial is means that there are many, many different potential causes for a fall. So oftentimes when we hear older adults talk about their falls, they say, oh, well, it's just bad balance or weak legs, or I hear so often, well, I just wasn't paying attention. I just need to pay more attention. But there are so many different things that can contribute to fall risk. And also, these factors can create kind of a vicious cycle that can make your fall risk worse. And so this could include medical conditions. So often vision, hearing impairment, heart disease, arthritis, and even hypertension can also increase your fall risk. Medications. So Dr. Patel talked a lot about the risks of different medications, but just keeping in mind that like some medications, their side effects and their sometimes even their side effects that show that they're working can have an effect on your balance, but also interactions amongst medications, and then also polypharmacy. Polypharmacy is the concept of you having so many medications that you are getting additional side effects and that there are interactions within your medications because you have so many different medications. I was actually just talking about this with a mentor and colleague and friend of mine who is an older adult. And she was sharing that, she goes to the doctor and she complains about one thing and she gets a medication. And then she goes into the doctor and complains about another thing and she gets another medication. That medication has a side effect, and so she gets another medication to take care of the side effect. And that medication has a side effect. And so then you end up having a lot of different medications. And so there's actually a big process through accessing a pharmacist where you might be able to um, review through pharmacy and pharmacy care management, as well as through like a comprehensive medication review. You might be able to determine what medications might be contributing to your fall risk and if there's any interactions. Um, then also, one of the people that few people don't know is that mental health can also really heavily contribute to your fall risk, especially depression and fear of falling and anxiety as well. So, what happens when you are depressed is that you become more isolated, you become less engaged in social and physical activity, and this can also be as a result of fear of falling. Dr. Patel also talked extensively about the home environment, but your ability to make those modifications to make your home safer are really heavily impacted by social factors and also your physical environment as well. And then we'll talk a little bit more about how social and economic conditions can contribute to your fall risk because there are many, many different factors. And so if you think about it like puzzle pieces, when they fit together in the wrong way, a fall can happen. Um, but if they fit together in the right way, you know what's possible to prevent a fall. Because our motto in the Rush Generations team, and then also inspired by the National Council on Aging and national experts in falls prevention, is that we firmly believe that all falls are preventable and that falls are not a natural part of aging. So we can definitely contribute to figuring out what caused the falls and not just chalking it up to, oh, it was bad balance, weak legs, or I wasn't paying attention. It's really important that we socialize ourselves to think about when we have falls and when we have near falls, really getting to really getting down to what were the causes of the falls and what were those puzzle pieces that unfortunately made that fall occur. So now let's get off on a little bit of a different topic and talk about the social drivers of health. So these are often referred to as the social determinants of health, but we've reframed it in a lot of different spaces to be social drivers of health to be more accurate because essentially these different factors might not determine your health, but are definitely driving factors towards your health. So, social drivers of health are defined as the conditions where people live, learn, work, play, and age. And this can include safe housing, transportation access, neighborhood safety, income security, food access, social connection and engagement, caregiving, and immigration status. And so you may be asking, Patrick, why are you talking about these social drivers of health when we're at a falls prevention lecture? Well, therein is my research. So a lot of the factors that contribute to falls are very heavily impacted by the social drivers of health. And so my research focuses on how do the social drivers of health impact fall risk and making and strengthening that connection, and then also strengthening the connection to that addressing the social drivers of health and addressing issues like safe housing, transportation, neighborhood safety, all of these, food access, especially caregiving status, addressing all of these things is pertinent to fall prevention, to a comprehensive approach to fall prevention. And so, while a lot of our current understanding of falls is rooted in understanding the physical and mental contributors of fall risk, so where it lies on you as an individual, our research focuses to strengthen how structural and social factors also drive falls risk as well. So we're not negating that there are these clinical falls risks that we've already talked about because that is well established. But we're thinking about how do social drivers of health also contribute to your fall risk? Well, where it makes you more likely to fall, and then also might keep you from being able to recover from falls or prevent future falls, or to create a safe environment in which you can prevent falls. So, some examples are how unsafe housing can often be, clutter, poor lighting, lack of grab bars, etc. That can also markedly um, increase fall risk. Unsafe sidewalks or streets can lead to a fear of walking outside and not wanting to go to different areas, not wanting to exercise, not wanting to go to the park, not wanting to go on your daily walk if sidewalks or streets are there. And this is really, really, I'll go back to a story after this. I'm a man of many stories, so I got to try to keep on track. But lack of transportation can lead to missed doctor's visits, not being able to access therapy, not being able to go to therapy appointments, not being living in neighborhoods where maybe there aren't physical therapy offices, that you have to go really far to get physical therapy, and also access to socialization. Because some research that we've actually found is that people who socialize more and are more socially active have fewer falls. Their falls are less intense and that they have quicker recovery from falls. And socialization is a huge, huge impact on that. And then also, if you are low income, if you have to choose between your rent, food, medications, and your home modifications, if you have to choose between those things, it's clear that, maintaining your balance and making those modifications in your home or having enough food to be able to be nutritious and, like having access even to like clean water is a huge aspect because dehydration is a huge contributor to fall risk. And so again, social isolation is also really big. When you have fewer options for engagement, you also have fewer options for support, motivation, and socialization. So also a big factor that contributes to falls is your mental health and internalized ageism. So I always say internalized ageism instead of stigma. I don't believe in the stigma. I believe in internalized ageism. So a lot of times, stigma manifests as ways in which we have we feel shame about our aging and we feel shame about the reality of our aging. So we have a worry about being seen as old, a fear of losing independence, a fear of being placed in care that leads us to, again, as most isms, they lead us to harm ourselves and they cause more harm than they do good. But very closely related to internalized ageism, sometimes known as stigma, is the fear of falling. So, a fear of falling can be really pervasive in older adults, and fear of falling can creep into your life in different ways. So, you could have a fall or a near fall. You could have a loved one who has a fall or a near fall, and you saw what it did to them. You could just feel that your balance is starting to go. Or any number of different things can lead to an increased fear of falling. And this is a vicious cycle because the fear of falling tells our brain that we need to stop different activities. That, okay, it could affect us in our willingness to do physical activity. So we could say, I'm not going to that Zumba class anymore because I'm afraid that I might fall and break a hip. Or I'm not going on my daily walk anymore because I'm afraid that I might have a fall. Or I'm not going to exercise at home because it hurts or I might fall. And then it also impacts us in social ways and keeps us from doing the things that we enjoy, the things that matter most to us. And so you might say, "Oh, I really enjoyed going to the theater, but those seats are, so dark and the seats are so steep, so I don't go anymore." Or, "Oh, I wish that I could go to the family reunion and see my family and see the grandkids and the great grandkids, but all those kids are going to be running around and I might trip over them and I might fall." And so you might go stay at home. But the sad thing is that if you isolate yourself socially and isolate yourself physically, you actually become significantly more likely to have a fall. You lose strength, you lose socialization opportunities, you are less connected, and so you are more likely to fall and less likely to recover well from a fall if you are not physically and socially active. And so that's actually a big focus of one of our programs, A Matter of Balance, is helping older adults combat their fear of falling so that they can return to higher social and physical activity level. And also related to mental health and internalized ageism, depression and anxiety are shown through research to increase fall risk as well. And many older adults don't tell their doctor about falls because, again, of this shame. Dr. Patel talked about this as well, but fewer than half do, according to the CDC. So you may be wondering, what are ways in which I can protect myself? What are some ways in which I can, come out on the positive end and prevent falls and by staying socially and physically active? So, protective factors that we found amongst older adults that either have fewer falls or recover better from falls or have less falls that result in an injury is that they have strong social support. This can mean family, friends, neighborhoods, or even community involvement. This may not necessarily mean that you fall less, but it does mean that you're getting out, you're moving more, and that more people are around to check on you and that you might be more willing to ask for help when you need it, which is a huge also predictor for falls risk, is when you need help, are you able to ask it? And so I always say that everyone, falls prevention is a team effort with the multifactorial nature of falls, but falls prevention is also a village effort. And so I always say that if you want to have a village, you need to be a villager. So a big part of being a villager is offering help to others and receiving help when you need it. You know that it feels good when you help other people. So why don't you let other people help you so that they can feel good about that as well? It helps prevent falls. It helps strengthen your community. So again, there's a reason for people that care about you that they want to help you. And so essentially the internalized ageism keeps us from seeking out those resources. And we need to really make sure to strengthen that so that we can be well connected and have strong social support because that is a huge factor in preventing falls. And also safe, well-lit homes and communities. So I want to talk a little bit about that around a workshop that we did in East Garfield Park. So we did a workshop in East Garfield Park in a senior building. This is before the pandemic, so it was at least 6 or 7 years ago. And the residents there participated in the Matter of Balance workshop. And they really loved it, and they really were trying to overcome their fears of falling. And there were people who were really hesitant to walk, and other people who were more willing to walk. And so they decided that as a group, they were going to go on a walking group together. And so they had overcome this fear of falling. And through social support and supporting each other in the building, they wanted to go on these walks. But then they found that around their building, there were no sidewalks and there were lots of potholes in the streets. And then when they did get to sidewalks, those sidewalks were not well kept. And then also they were hesitant to go out during the evening and in the morning because some of the street lamps were out and it wasn't well lit. And so essentially a lot of the participants, they were like, well, I guess it can't happen. And it's one of my biggest ways in which I feel that we have accomplished real community building through our programs was because we could have just said, "Oh, well, that's okay. Why don't you just try walking within your building or getting on a treadmill in the social room or whatever it might have been." But I said, "No, like let's talk to your alderman. Like let's bring your concerns to the alderman and say like, "Hey, there's a senior building here. We want to go on walks because it's a huge part of falls prevention. It's a huge part of chronic condition management, getting exercise, getting out there, socializing. It's important for us." And so we brought those concerns to the alderman. The alderman heard us out, and around that senior building, there are well kept up um, sidewalks and well lit areas. And this really has even though this was 6 years ago, it even goes through to today because recently I was meeting with that senior building, and the older adults who live in that building are so empowered every time that they see like potholes or see sidewalks that need repair or see like one thing was like a pipe that was like sticking up out of the ground that someone tripped over. They're immediately on it. They're like talking to the alderman about it specifically. And so I'm like, we did such a long-term investment into like empowering this small community. And I think that that was really demonstrative of how possible this is. And then also affordable exercise programs are really important. Um, so these are things, so people who are involved in exercise are substantially less likely to fall. And I know that Dr. Patel mentioned this as well, but Rush Generations provides a lot of different opportunities for accessible exercise programs. And there are many exercise programs specifically for seniors in the Park District and other area agencies on aging if you're not in the Chicagoland area. Then also having trusted relationships with your providers. So recognizing that you can tell your providers when you've had a fall. You need to be able to be vulnerable and upfront and honest with your providers. And being able to trust your providers is a huge protective factor in being able to be more open about talking about fall risk, because then you can also talk about prevention, and can also talk about preventing future falls. And then also a huge predictor of if people are able to stay upright and prevent falls is access to social care workers, like social workers, resident service coordinators, community health workers, or promotoras. So it could be social care workers, care managers, or other advocates. So a huge thing that I hear from people in different communities is, oh, I'm able to access the resources that I have because I was connected through a community health worker or promotora. Or people will talk about their resident service coordinator at their building if they live in a senior building, which is referred to as an older adult independent living facility, known as a senior building in lay terms. But that every single senior building has a resident service coordinator, and those resident service coordinators are supposed to be there really helping people get what they need to stay healthy and to be supported in their living. And so the good quality resident service coordinator is absolutely gold. And it's amazing when someone is connected to an advocate, to a good resident service coordinator or a good community health worker or a good social worker. It can make all the difference of having someone in your corner to advocate for you and to help you navigate the complex resources and the complex systems that we have to navigate within the United States. And so again, the role of social work and social care, again, is helping people navigate health systems and also insurance about like what does insurance cover, what does it not cover, especially when it comes to physical therapy or specialty care or orthopedic care, what you might need, getting access to durable medical equipment or assistive devices. Those can be really hard to navigate. And so having a social worker help you navigate those resources can be incredible and can help you prevent falls. We can also connect patients to pardon me, home modification programs. We do have one here at Rush. It is an amazing program, a home modification program, where you can make small modifications to your home so that it's safer, like grab bars or things like that. Transportation and even food support, because we know that malnutrition and dehydration are also huge predictors of fall risk. And so if you are not having enough food to make it through the end of the week, or you don't have access to clean water, like those are things that really heavily impact your fall risk that are so incredibly linked to social status and social care. So, and then supporting your social workers also have a role in supporting your mental health and helping to reduce stigma. So helping you overcome those fears, overcome the shame that you might have around balance or fall risk. And then also social workers and social care workers, like community health workers, are amazing at partnering with families, caregivers, and professionals, because remember that so that fall prevention is a team effort and is also a village effort. And so you might wonder, what are the different members of my healthcare team and how do they help me prevent falls? So your doctors can help manage your chronic conditions, and then also really good doctors who work in senior care or in internal medicine or primary care or even specialty care, especially Dr. Patel and doctors like her, can also have really productive conversations with you about your fall risk and help you get connected to other resources. Pharmacists are able to review your medications and may be able to suggest how you might be able to afford your medications more, or how you might be able to avoid side effects, or review whether some medications might need to be cut, which need to be approved by your doctor. Therapists, so like physical therapists and occupational therapists, can strengthen balance, can improve your safety in the home, can help you make home modifications, can help you adapt to your new level of mobility. So say, for example, if you have Parkinson's disease, or if you've had a stroke, or if you've had, or if you have where you lose through diabetes, if you lose feeling in your feet or hands, those all massively increase your fall risk. And so talking with a physical therapist and occupational therapist can be paramount in helping you learn how to navigate your home safely with changed mobility due to other factors like that. So again, regardless of how your balance currently is, there are things that you can do to prevent falls. Nurses also have a huge role in falls prevention, so educating and supporting patients, helping manage medications and tests, explaining tests, getting people into tests, whatever it might be, as well as community-based education and also just educating at the bedside for inpatient. And then social workers and community health workers can navigate resources. We center the patient. We can focus on mental health. We can advocate for equity. We can help you navigate systems. We can help you even advocate to your alderman for better sidewalks. And then also, I forgot to include here, public health workers as well are constantly advocating for funding, for resources, for data, for research. So just amazing how um, every profession within the medical team has such an important role with fall prevention, and it just doesn't fall on one person. And so you might be wondering, I mentioned before, what are some of the programs that we can get into? And so the ones with the asterisks are ones that are offered by Rush Generation. So we have a Matter of Balance, which I talked about, helps you really overcome your fear of falling to help you return to higher activity level. So we do a lot of what we call cognitive restructuring, which is taking your negative thoughts and turning them into positive, helpful thoughts. Assertiveness training. So we go through scenarios about like where you might want to practice assertiveness and problem solving. So say, for example, you know, if your landlord tells you that you're not allowed to install bars in your shower, but you know through the law that you are able to. So how do we problem solve? How do we advocate for yourself? Um, Fit and Strong is also a program where it is a program that markedly improves your balance through really intensive resistance and weight exercise. We also have Tai Chi for arthritis and falls prevention, which Dr. Patel mentioned that Tai Chi is studied by research and shown to be massively helpful for falls. And we also have bingo size, which is we do 3 rolls of bingo, 3 exercises, 3 rolls of bingo, 3 exercises. So after an hour, you get a good sweat going on and you might win some prizes, which really fun program. But essentially, we have all these different programs so that we have multiple different opportunities for you to engage in something that might work for you. And the cool thing about these programs is that while some are at Rush, most are out in the community and some are also virtual. So we have virtual programs where you can participate through Zoom. There are in-person programs at Rush, and then we're in a ton of different organizations um, like we're in senior buildings, senior centers, community-based organizations, churches. So there's so many different locations that we're in, and Rush Generations offers, in the last fiscal year, we offered 58 groups. And in this fiscal year, we're looking at offering between 65 and 70 groups. So it's never too long before the next one that you can get involved in. And then also, while I mentioned some of the ones that Rush Generations offers, any area agency on aging within the nation has the ability to offer these fall prevention programs. And so if you don't, if you reach out to your area agency on aging and they don't offer any of these programs, you can ask them why. And you can find locators if you're in Illinois. There is illinoispathwaystohealth.org so that you can find a workshop coming up near you, or you can contact the Rush Generations program. And so some other programs that might be available throughout Illinois and throughout the nation are Tai Chi One, Moving for Better Balance, Stepping On, the Otago Exercise Program, and so many more. You can learn about all the different evidence-based programs for falls prevention through the National Council on Aging website as well. And so some things you can do are talk openly about falls with your providers. So again, being more open to talking about your fall risk and what you can do to prevent falls, and being honest and upfront with your providers when you've had falls to find out how you might be able to prevent future falls and understand why you had the fall. You can also ask about exercise classes, physical therapy, or community programs. Make small changes in your homes, like improving lighting, like installing grab bars, removing clutter, getting rid of area rugs, staying connected with family, friends in your community. and seeking help if you are depressed, anxious, or afraid of falling, and always consider attending an exercise program. And so remember that falls prevention is possible and that falls are not a natural part of aging and that everyone on your care team has a role. So provide as well as your caregivers, your families, and your communities, and that social drivers of health matter just as much as medical factors in preventing a fall and causing falls. And together we can create safer, healthier aging, and have a better understanding of how to stay upright.
Thank you, Patrick. And thank you, Dr. Patel. Yes, staying upright, staying strong. So thank you for all the information that you provided us, but also the significant work that you're doing. Both of you are out in the community. I wanted to open first the opportunity for our callers. You can unmute yourself by dialing *6 or *6 so that you can go ahead.
Hi, this is Paula Shapiro. Hi, Patrick. Thank you for all of your information, and we love First Generations. I saw Jeannie this morning for Tai Chi, and anybody who hasn't tried it should try it. It's amazing. But I have a question for you. You said many falls are preventable, and I recently had a terrible fall where I fractured a rib. I was in a gym. I was going to just get ready to start my exercise on my bike, and I went to open up a window, and I didn't see two little tiny wheels on the exercise bike, and I fell like a brick. What could I have done to prevent that?
So, I mean, it's to mention, I mean, sometimes a lot of falls happen because, we're not paying attention or we're not seeing, what's in front of us. And so that can sometimes be, just be slowing down and paying, really not letting things rush you and trying not to multitask. So the thing is that, and Dr. Patel, you might be able to back me up here as well, because um, for me, when I think about is that so many of us fall often when we're being careless, and it's a lesson not just for older adults, but it's a lesson for all of us to practice more mindfulness and to like multitask less and to focus on what we're doing and be aware because I'm like I shared with my team and a couple of friends that like I had a fall like a couple weeks ago and ended up needing stitches. And I'm like, I'm 35 years old, so I'm like, it's a thing of like we fall. And of course it was like, hey, I wasn't paying attention, but I also was thinking about what are some other factors that might have contributed to my fall and how might I be more cognizant and more mindful in the future. Um, but not to mention that like we can't rule out that there might have been other factors that contributed to your fall, not necessarily just like, oh, I wasn't paying attention, I didn't see this, and then I fell and I do that. And I'm also very sorry to hear about your
Yeah.
fall.
Thank you. Everybody
Yeah.
always tells me I rush around too much, But in this particular situation, I was done with my patients for the day, and I was just ready to relax and just get in the gym and do a little workout. And I can't figure out how I did that, And as a nurse who teaches falls prevention, I feel kind of guilty about this.
I bet that it's frustrating because you're doing so much to make sure that you remain strong and then that you're able to do everything throughout your day. And then you experience a fall, a significant fall for that matter. Sorry, Dr. Patel, I saw you unmuted. Go ahead.
Yeah, I was just actually gonna say, I don't think you should ever feel bad. That almost kind of um, that kind of proves our point of it doesn't really matter of our occupation or our age. We all have falls, so I don't ever want you to think that you feel guilty that you're teaching others about fall prevention and then it's happening to you. I do think in regards to prevention, maybe, if you're focusing on the gym, just like really just mentally being there, it is very hard, even as um, a, a physician. I find myself with my mind thinking 50 things at the same time and
Oh,
sometimes
yeah.
not paying attention to the thing I'm doing in the moment, just because we
Right.
have such a busy life. So I think as long as it's not happening frequently, right? Like if you're falling more often, um, than just this one time off, I would definitely get assessment, like Mr. Stanley said. But otherwise, I wouldn't be so hard on yourself. I think this is just maybe an indication that you need to take time for yourself and be present in the moment. And I think all of us can kind of feel and relate to that.
Okay. So the next
Yeah.
time Patrick asks me to be a leader of the class, I should.
That will be
Absolutely.
lovely.
Yes.
Yeah, we would love to have you, honestly.
That will be lovely. But
Yes.
actually,
But
yes, let me
I think it's
connect this
also
with,
like,
go ahead,
oh,
Patrick.
sorry. I
But
was just saying that
I
we should
felt
probably
because
rephrase that too.
I thought because I fell that I would not be a good example, Patrick.
Mm.
No, actually, I wanted to connect this with a question in terms of, we talked about fear of falling. So Dr. Patel said that one fall can lead to more falls. And on top of that, people can develop, as Patrick said, a fear of falling. So when you have those two, what are some of the things that we can do so that it's not recurrent, and it seems that not avoiding the mobility that you mentioned or continuing to do things that strengthen your muscles, because I mean, we do know that muscle, and I think this was Dr. Gabrielle Lyon who said that muscle is the organ of longevity. So making sure that we have strong muscles is key for our longevity. So yeah, how do we make sure that after one fall, we don't continue to get
I
into
can
Right.
that
speak from a
spiral?
I can speak from a medical standpoint. I think I breezed over this during my presentation, and I feel like maybe I should speak about it a little bit more deeper. Um, there's something we called a DEXA scan, and that is it's a screening for bone density or osteoporosis. So as we grow older, our bone density physiologically decreases. But the DEXA scan is a way for physicians to there's two scores that are reported, the T score and the Z score. And I'm not going to go too much into detail because no one needs to really know that other than who's reading the scan. But it's a low dose X-ray that's taken. And these scores are related to patients of that specific age group and seeing how their bone density is. So medically speaking, as you grow older, your bone density does gradually decrease. But if it's decreasing at an exponential level, then there's medications that are actually preventative for helping with that decrease in bone density. And so osteoporotic patients are found to have higher risks of falls. And so that's something really important. And I am a huge advocate for getting DEXA scans, even on my 90, like today I had two 97-year-old patients in my clinic, and both of them got DEXA scan orders because I just think it's a wonderful way of preventing falls and preventing the hip and the femur fractures. So
Yeah,
that's something
because
I would say from medical.
you're measuring the
Yes.
strength, the bone density, and all of that. Yeah, that
Yeah.
makes sense.
And then vitamin, any multivitamin I would always recommend as well, especially vitamin D, calcium.
Okay. Excellent.
Very good. Thank you.
Excellent. You. 'Thank you for the question. Thank 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 you for the question. T Anyone else before I move on to other from the YouTube channel? And thank you for clarifying about the DEXA scan. Yes, making sure that people are getting the data that they need to know where they need
Yes.
to, what they need to do next.
Yeah, and that's part of the annual, sorry, didn't mean to
No,
speak over
go
you, but
ahead.
that's part of the annual physical. I do have some patients, and as they should be asking these questions, I will see patients pretty regularly for their chronic conditions, and then I'll say, "Hey, in 2 months or 3 months, you're due for that annual wellness." And a lot of the questions are, "Why do I need to get this?" That is the reason why I always recommend my patients to get an annual wellness visit, just because these things are discussed in depth, and any questions in regards to how to prevent falls or what a DEXA scan is, what a mammogram is, all of this is discussed during that visit because you have a longer period of time to talk with your primary care provider.
Wonderful, wonderful. So one question, since you said, Dr. Patel, which is unfortunate, but less than half of those who experience a fall then tell their doctors. And it seems that Patrick also touched on some of the reasons why people will shy away from speaking up about a fall. But then knowing that, is this a routine question? Like now we go to our doctors and we're like, do you feel safe at home? And, in terms of knowing if that's more about domestic violence or something like that, but is this a routine question that is asked, or it should be asked in each visit?
So in regards to, so for example, at the senior care center at Rush, we ask, it is part of our template ask for each visit. So it doesn't matter if the patient's establishing care is an annual visit or a follow-up visit. One of the questions we ask is, how is your mood? And the other question we ask is, have you had any falls in the last 24 months? So that kind of covers, hey, yeah, I almost fell or I did fall. What happened? How did it happen? Was it a blood pressure medication that might have caused the fall, or another medication? Or was it something more environmental, like the rolling walker cane, or things that are indestructive in the way of a path or something like that? So we do discuss it. It is important to discuss it with your doctor. And I do got to say, in my training where I did residency, because we saw patients of all ages, it wasn't as readily asked. But I think that's where a geriatrician comes into handy, is because we are programmed to ask these questions just because they're common.
Mhm, mhm.
And I think there's also like a lot of shame about falls. So we're trying to do so much education and empowerment to, again, overcome that internalized ageism so that people feel more comfortable telling their provider that they fell. But then also providing some education around like what is a fall. And so I've actually had patients where I've, asked them, okay, and tell me if you've fallen in the last 6 months or in the last year. And they'll be like, no, I haven't fallen. And I'm like, well, you literally told me that you fell a little bit ago. And they're like, well, I didn't hurt myself. And so sometimes people like won't consider it as a fall that they need to tell their doctor about if they didn't hurt themselves.
Yeah.
And so if you're falling, even if you don't hurt yourself with your falls, you need to tell your doctor. And I think also something that I've heard often, and Dr. Patel's point as well, is that sometimes people think that, oh, well, why would I tell my primary about my falls? Like, I should wait. And like, that's a thing for a physical therapist, or I should, if I'm falling, I should go to an orthopedist. Like, why should I tell my primary care doctor about
Yeah,
my
yeah.
falls? And I'm like, no, you absolutely can tell your primary
Mm.
about your falls. Like, a lot of folks who are in kind of more general practice, like family medicine or internal medicine, might not be asking you about your falls, but they're going to be able to help you if you tell them that you're falling.
So the message here also is like, any balance concerns, or if you are feeling even a tiny bit frail, just be open to talk about that, because muscle is key. Is key actually to quality of life, to be able to do all your what we call activities of daily living, everything that you need to do. Then it's related to how your strength and your ability to, what is it that you say, Patrick, to stay straight,
Stay upright. Yeah.
upright. I like that. And so one last question before we wrap up, and I'm so sorry, I think I lost it. Do. Oh, I think there was something in terms of social isolation and social connection. I'm glad you touched on that, Patrick, because people, when we talk about social isolation and the importance, it's not only about socializing when you get to connect with others, but then you create that support and that feedback that you probably don't notice if you're a little bit off balance, or you probably not noticing if you're limping a little bit. And when you have people around you, then those could be the best people to tell you, have you considered going to Dr. Patel or going to Fit and Strong?
Yeah, I think social isolation is huge because it impacts you not just practically in those ways in which, you're going to be more connected and your people are going to notice and you're going to have more support, but also the fact that social isolation and loneliness really negatively impact your health. There's that statistic that shows that, being socially isolated and lonely is one of those things that impacts your lifespan less at the same amount as smoking. And so obviously that probably has a huge impact on your health as well, that can also affect your balance. And so I believe that it's, not just, that practical way, but it's also in a physical and clinical way as well, that social isolation impacts your fall risk.
Okay, found the question. And probably if you don't know about this, I will encourage this person to also call our helpline, because it's about services that, if there are services to hire a person to travel with you out of town for special medical care at a hospital. So it seems that this person needs a companion. So if there are services that offer companionship for out of town traveling, I'm not sure, but one thing that you can do to this YouTube person in the audience, feel free to call our toll-free number. We have the 1-800-757-0202, the same number that you use to register for our programs. You can just let us know any services that you're trying to find, and we have dedicated agents to give you a call, to give people a call for those. Well, thank you so much to both of you. This was great topic for Falls Prevention Awareness Week. Any closing thoughts?
No, I just want to take the time to thank you both for inviting me to this talk. I am really passionate about this population, so it's just wonderful to be able to spread the word and help out as in any way I can. I do work at the Senior Care Center, so if anyone wants to come visit me, come on over.
Great. Thank you.
Yeah, thank you to your for you as thank you to you for yours work as well. Geriatric physicians and are absolutely gold, and we need so many more of you.
We do, literally, because there's a shortage. So, okay, thank you both. Okay, and then I'm gonna let you know about some of those programs that we have coming up at Rush Generations. And speaking about balance, we have a balance screening that is coming up. Is throughout this month. This is part of the celebrations that we are doing throughout this month. We are not only hosting lectures like this one, but also balance screenings to celebrate falls prevention awareness week and to empower you. That was something else that came through this talk. How is it that the relationship with your providers can help you, can empower you to then do more for yourself and your community, including Patrick's example. So tomorrow is our final balance screening for the month. So we'll have more, but for this month, that one, the next one is this one on Thursday, September 25th from 10 a.m. to 1 p.m. And it's going to be the Southwest Senior Center here in Chicago. That one is located at 6117 South Kedzie Avenue. No appointments are necessary to join. Just go there and show up at 6117 South Kedzie Avenue. And each screening takes between 15 and 20 minutes. We hope that you can join. And if not, feel free to always visit our webpage so that way you have more information about the programs that we have coming up all the time, that we post on the right side of the website. You can see always what programs are going to be offered. Then the other program that we have coming up is Matter of Balance. You heard Patrick mention it a few times. This is an 8-week session workshop, or as a session workshop. I shouldn't say 8 weeks because some of them are offered twice a week. But this one is for individuals who have become restricting their physical or social activities because of a fear of falling. And you just heard us talk about that. The workshop utilizes problem solving, balance improving exercises, confidence building, and cognitive restructuring to help participants prevent falls, improve their balance, and regain the ability to do what is most important to them. And the next workshop is going to be held in person on the Rush campus, Tuesdays and Thursdays. So it's 4 weeks, 8 sessions, but over 4 weeks. And it started yesterday, but you still have a chance to join. And it's going to be through October 16, 1 to 3 p.m. So make sure that, yes.
I'm so sorry. I just wanted to share that we did push this one back. So that one will actually be starting in November because we had low enrollment. So we hope that all of you on the call and listening will join our next one because we had to move this back due to low enrollment. So
Okay, perfect. So you still have an opportunity to join. So make sure you call us 1-800-757-0202. Great. Okay. As always, we want to hear from you. Shulman Senior Voices aims to empower older adults to discuss what matters most to them as they age. So please consider sharing your wisdom on why it is important for your healthcare team as well as loved ones to know your goals and wishes and what matters most to you. So scan that QR code to record on a mobile device or a smartphone and let us know how you feel. The next lecture is going to be on Wednesday, October 1st, and is Elder Frauds and Scam. Again, starting at 1 p.m. And we hope to see you there. All right. Thank you, everyone, for joining us today.